So at the moment we have a visiting team which is led by Dr. Sean Setti, who's from the US. So this team comprises of doctors and nurses and medical professionals from the United States, from Australia, from New Zealand, and also from Oman. There are a total of 21 in the visiting team. So far they've already done 17 surgeries, and they're continuing to operate till next Tuesday, which is the 25th of April. And they may do between 25 to 27 or 8 surgeries during this trip. So the hospital will turn 1 on the 27th of April. There are some plans in place, so we will be hosting a global pediatric cardiac conference on the 26th of April. This is where doctors, nurses and medical professionals from around Fiji and the Pacific Islands can come and know more about pediatric cardiac care in Fiji and the Pacific Islands. We have some amazing speakers from around the world who are experts in this field of pediatric cardiology, surgery, anesthesia, and so it's going to be a fantastic one-day conference. And on the 27th of April we will be celebrating, we will have an event where we'll be celebrating the gift of life for all the children who have surgeries during this visit, and also celebrate the first anniversary of our hospital, and we'll have a very special guest, chief guest on that day as well. I'll be celebrating with our visiting team, with of course the families and the children that have their surgeries, and also people who have supported the hospital, many of the government officials, the diplomatic community, our donors, and many other people who have worked with us will be a part of these celebrations. We also have people who've come from around the world, from Australia, New Zealand and India, and various other countries to celebrate with us. So it'll be a truly momentous occasion to mark the first anniversary of the Sri Sathya Sai Sanjeevani Children's Hospital. What's very special this time around is also that we have children from the Pacific Islands who are having their surgeries. We have children from the Solomon Islands and also from Kiribati, and of course from all over Fiji. So this has been very exciting, and as we go along we'll have more children come from more parts of the Pacific and other islands in the coming months, and we'll have more surgeries happening in July and then again in September and in November. So we're going to have visiting teams coming every sort of second month and operating on our children. And of course, as you know, there is no billing counter. All services are rendered completely free of cost, so there's no cost to the parent or the child. While the children are here, we feed them with 6 meals. We also feed the parents, and really everything is done with love and compassion. I mean, I think that's what Sanjeevani stands for, is compassionate care. It's holistic care, and it's really that journey of the child from the pre-operative ward through to the operating theatre, to the intensive care unit, into the post-operative ward, and then to their homes. Well, there are always many challenges. I mean, to even build a hospital, there are several challenges. We had to build through COVID-19 pandemic. It's a $25 million project. The government has granted the land, but we haven't received any funding from any other sort of international aid agencies or government. It's been individuals from around the world who have felt for our cause, who've helped us. So it's not easy to build a facility, of international standards. Of course, there are costs associated with things. We have to procure a lot of things from many parts of the world, and delays with shipping. So there are multiple challenges, but I think that we're trying our best to go past these challenges and to continue with the work, because what truly matters to us is giving that gift of life to this parent or child, giving and instilling hope in them, because many of these children would not survive if they didn't have this life-saving surgery. And I'd like to say my sincere gratitude to the visiting teams that come, because they come with expertise, and they're also willing to help teach and train our local medical professionals as well. So we do have local doctors and nurses that are working with the visiting team. So it's a big exercise, but it's been a wonderful journey for the Sanjeevani Hospital. We're still an infant, so a lot more work has to happen. We are reaching out to the Pacific. We had sent our echo technician to Kiribati to screen. One of the pediatricians, Dr. Marianne, went and screened in Solomon Islands. Our hospital and our team have screened in all the health centers in VC level, Vanua level, also gone to Levuka, Tabiuni. So there's a lot of work happening in terms of early identification, screening of children, and of course then, preparing with children, discussing with the surgeons, the cardiologists, which children will need surgery and who will need it urgently. So there's a lot of work that continues to happen. Procuring medications and consumables can be a challenge. We don't have much available in Fiji, so we have to source a lot of things from around the world, and there's a global shortage of oxygenators, which are used for perfusion for open heart surgeries. So it's a big exercise, a lot of things have to come together to make it all work, and we have very dedicated team, that our hospital team that work day in, day out, in many other areas as well, in the kitchen, in the laundry, in the CSSD sterilizing, our admin team. So many people are working day in, day out to make this all possible.